Hello, everyone, and welcome to Brain Bites, where we discuss topics related to the nervous system and health. Today's topic is telemedicine. There are several terms being used to describe medical care for when patients and practitioners are in different locations. Telehealth is the all-encompassing term for virtual care visits that includes telemedicine, telepsychiatry, teletherapy, each with its own area of focus and guidelines. Regardless of the focus area, all require that the service and care use two-way, real-time, interactive audio and video. Today, we've invited Dr. Sharon Norling to share her experience with telemedicine. Dr. Norling, thank you so much for your time and expertise. Could you now share how you use telemedicine in your own practice?
Yes, thank you, Nathan. I'm excited to talk about telemedicine because today we have so many areas through technology that we can help our patients and our practice. So some of the benefits that are for your patients when you're doing telemedicine is actually because a patient, this is often patient driven. They actually want to continue care from you, their provider. And many times it's difficult to get to an office visit. Patients often are working and it's difficult to get away from work, or there's traffic, or there's adverse weather conditions. Sometimes our patients are caring for their elderly parents, or they have children that they're taking care of. And sometimes our patients are actually elderly. I'm originally from Minnesota, and so I understand the importance of having access available for our rural patients. There's also benefits to your practice. And I've been doing telemedicine for about 6 years now because it was actually patient driven. They requested it. But it's beneficial to your practice as well. We can provide service to patients when they are either unwilling or unable to come to the office. And there's a source of revenue generation as well. And it does decrease overhead. The limitations are, of course, that you can't do procedures, and there's limits on drug prescriptions. So this is the nuts and bolts of it. How do we make it happen? Well, the first thing you need to do in your office is have a private area in a secluded place. And there's a variety of ways where you can communicate with your patient. You can do it on the phone. You can use some video or audio system. It could be Skype, it can be Zoom. Zoom actually has a telehealth link on it, which is HIPAA compliant, and we always need to be HIPAA compliant. Then we can also communicate by sending digital educational materials as well as marketing materials. And Synesco is really good at providing those tools for us as we're doing telemedicine today. Many practitioners will have test kits available in their offices. I happen to carry them in my office, and I also carry the targeted nutrient therapies in my office. So I can actually, after the telemedicine appointment, I can actually have my office staff send the kits to the patient or send the formulas to the patient. They can also be drop shipped by Synesco. Once the results are back, we can actually scan those results to the patient via email. So when they're talking to us on their next appointment and we're going over the results and correlating the results with the symptoms that they presented with and being able to give them a natural solution with targeted nutrient therapies, the patient will be looking at the same lab report as we are. And so it's very convenient to do it this way. It's key for you to actually follow up with your licensing organization for guidelines that are specific for your area of expertise. Now, the communication system management, this is the cornerstone of Synesco. And obviously, it has the neuroendocrine system of testing, and it's an at-home collection. So patients will collect urine and saliva, and then put the samples into the box again. And there's a prepaid return shipping envelope or label in that box. The personalized analysis, as I mentioned, that lab report is comprehensive, it's personalized for the patient. And the one thing I really feel strongly about is treating the average is overrated. One size fits all does not work. So we really do need to provide personalized care for our patients. When you're starting out using the system and you have questions about your patients or the results or the therapies, you can have a one-on-one consultation with our clinical support team. All you have to do is call customer service and they'll set up a mutually agreeable, convenient time for you. If you have a difficult patient or a complicated patient, we're also there to help you with that or to answer any questions about the lab or the supplements. And there is no charge for this consultation. Now, the targeted nutrient therapies, you can either stock in your office, which I do, I have a dispensary, or you can have them drop shipped through Senesco, or you can write a prescription for them so that the patient will actually be able to get it from one of the other companies that Senesco has their products on as well. Now, this slide is really important because, yes, we have the convenience of the kit. We have the excellent targeted nutrient therapies, but how does it really work? How significant are the improvements? This is a study of 20,000 patients looking at the quality of life impact. The green bars, you can see, this is how the patient felt before the testing and before the targeted nutrient therapies. And then you can see the results in the turquoise, and you can see the significant improvement in their quality of life, decreased anxiousness, decreased fatigue, decreased, poor memory, and the list goes on. I think one of the other things I want to say about this is that it's a great way to serve our patients is to use the targeted nutrient therapies. So it's really a nice option for your patient, and it works. The clinical model is actually made for telemedicine. So the first thing is, of course, test the patient, recommend the initial interventions, and provide this supplement support. The second step is really key to the success for your patient. It's important to retest because you want to know how the patient is doing. And as providers of healthcare, we are often testing our patients to monitor their success or to see if any therapies need to be adjusted. The third step is a second retest, and that is done, and it's so important because we want to ensure that that patient is really on the path to optimal health. And if indicated, we can adjust the therapies at that time as well. I also recommend that step 4. So that's the monitoring and having periodic testing, maybe every 6 months, 12 months, depending on how the patient is doing. And that ensures that the patient will stay in their place of optimal health. And we need our optimal health. We need it for so many reasons, to have the energy and the mental clarity and the motivation to lead, really productive and happy life. We deserve it, and everyone around us deserves it. And I want to also mention that healthcare providers, physicians, all of us in healthcare need to have this test done. I test every patient in my office, every patient, because everybody seems to be stressed or anxious or having depression, difficulty sleeping, fatigue, all the symptoms. And we should test ourselves as well.
Fantastic. Thank you so much, Dr. Norling, for sharing your insights with us. I now want to talk a little bit about some of the tools that we offer to help support telehealth clinics. Our media kit provides content for your website, while the practitioner dashboard contains digital marketing and education tools, such as email templates, presentations, and digital brochures. And finally, visit our website and follow us on social media for posts and blogs to share with your clients. And if you're already a Synesco provider, simply access your practitioner dashboard on our website or contact us for support. If you would like to add Synesco Health to your telemedicine practice, visit synescohealth.com and click on Become a Provider. And if you happen to be a patient, please visit our website to find a Synesco provider near you. We do hope that you've enjoyed this edition of Brain Bites. Please sign up for our newsletter and follow us on social media for more ways to put nervous system health back on track.